You know that feeling, right? You've just used a service, maybe visited a new restaurant or, even gone to the doctor, and you head online to share your thoughts. It's a simple act, really. But what if that feedback, those raw, unfiltered online reviews, could directly improve something as critical as healthcare services? Imagine, like a shortcut to truly understanding what patients actually need, bypassing these huge mountains of text.
Today, we're taking a deep dive into a really fascinating new approach. It combines the sheer power of patient online reviews with cutting-edge AI. And the core question we're exploring is this. Can a large language model, something like ChatGPT, accurately pinpoint specific healthcare needs just from patient feedback? And importantly, what does this actually mean for improving your experience as a patient and, how healthcare resources get allocated? We're digging into a pretty groundbreaking research article. It was published in PLOS One back in March 2025, titled Identifying Healthcare Needs with Patient Experience Reviews Using ChatGPT. And this isn't just some academic thought experiment.
It proposes a novel methodology, tests it really rigorously, and then explores its actual real-world applications. So our mission today is to unpack exactly how this technology works, understand its, frankly, impressive performance, and explore the big implications for providers, policymakers, and ultimately for you.
Yeah, and it tackles such a critical challenge because, globally, efficiently assessing and distributing medical resources, that's a massive hurdle for governments, for healthcare organizations everywhere. We constantly run into issues like overutilization of resources here, or maybe suboptimal allocation over there. And it's often because the traditional ways we assess things, they just don't capture the actual patient demands effectively. The system isn't as responsive as it really needs to be.
So patient feedback, then, it sounds like this untapped goldmine. If it's so valuable, why has it often been, overlooked? Or what makes it so hard to actually use effectively?
That's exactly the crux of the problem. Traditionally, getting actionable insights out of all that unstructured patient text, it's been incredibly difficult. Even with newer tools like deep learning and data mining, past approaches have really struggled to pinpoint specific areas of dissatisfaction within individual reviews. Think about it. One single long review might mix positive comments about the doctor with negative feelings about, say, the waiting room or the billing process. It's all jumbled. And this inability to get truly granular insights, it leads to unmet patient needs. That directly hits the patient experience, which we know is a vital part of healthcare quality.
Yeah, absolutely.
And research has even linked some of these unaddressed issues, things like doctor efficiency or administrative burdens to increased costs, and, more alarmingly, potentially higher medical errors or even mortality rates.
Wow, okay. That sounds incredibly complex then. How did the researchers even start to sift through that sheer volume of data? What tools did they use to get those specific insights?
Well, that's really where large language models, LLMs like ChatGPT, come in. They become indispensable. These models have been adopted really rapidly across so many fields, including medicine. You see them being used for everything from health counseling, education, medication management, even online consultations. They're genuinely changing the game by understanding and processing human language at a scale we've just never seen before.
And this study really leaned into that potential, right, on a huge scale. How much data are we actually talking about here?
We're talking an immense amount. They used over 504,000 patient reviews.
500,000. Wow.
Yeah. Collected from hotof.com, which is a major online medical platform in mainland China. And it's important to stress, these reviews are verified. They come from real patients with genuine consultation experiences.
Okay.
And a key technical point here, ChatGPT can directly process Chinese data. There's no need for translation first, which means you don't lose nuance or meaning.
That's crucial. So, okay, how did they actually crack the code? How did they get truly specific insights from these 500,000 reviews beyond just a simple good or bad?
That's the core innovation. They use something called aspect-based sentiment analysis templates, or ABSA for short.
ABSA templates, okay.
It's the key to moving beyond just a single positive or negative label for the whole review. It's about dissecting that review, looking at different aspects of the patient's experience.
Ah, okay. So it's like going from just knowing if someone liked their meal to knowing specifically if they liked the service or the ambiance or the food quality itself. That level of detail.
Exactly that. And the researchers developed 3 really clinically significant categories based on what patients actually care about. First, there's patient experience, PE. Now, this is broader than just, the clinic's atmosphere. It captures the patient's overall perspective on the physician and the entire visit.
Like, did they feel heard? Were they treated with respect? That kind of
Precisely. Then the second category is physician skills and efficiency, PSE. This one combines things like the treatment plan itself, how well the disease was actually alleviated, the doctor's efficiency, their professionalism.
And like you said earlier, negative feedback here could have really serious consequences, right? Increased costs, maybe worse outcomes. That sounds like a major red flag for a hospital.
It absolutely is. And finally, the third category, infrastructure and administration, ID. They broaden this one out quite a bit from just cost. It includes medical facilities, the environment, hygiene, how efficient registration is, even those seemingly small administrative things like parking difficulties.
Things that can really annoy you and sour the whole experience.
They really can. They might seem minor, but they significantly impact a patient's overall experience, maybe even affect how long they stay or if they'd even come back.
Okay, so no more vague reviews. We're talking super specific Michelin star level feedback for healthcare now. And the secret sauce for getting the AI to do this without it just being a guess like a black box is this chain of thought prompting, or COE. Can you break that down?
Absolutely. Code prompting is essentially about guiding the LLM to think step by step, applying logical reasoning. So instead of just throwing a review at it and saying summarize or what's the sentiment, you give it clear instructions like, first, extract all the sentences related to patient experience from this comment. Then analyze the sentiment of those sentences. Once that's done, move on to physician skills and efficiency. Extract those sentences, analyze their sentiment, and so on for each category.
So you're building a logical path for it to follow.
Exactly. A transparent, logical pathway.
And here's where it gets really interesting, I think. That transparency.
Yeah.
That feels like the game changer. It builds trust, especially in a field like healthcare, right? And it lets experts see how the AI reached its conclusion, maybe even spot if it went wrong somewhere.
Precisely. It turns what could be a black box into a tool you can actually understand and interrogate. And it also helps get around some common problems that trip up basic sentiment analysis. Things like sarcasm in reviews, or really specialized medical terms messing with the AI's judgment. Breaking it down helps maintain precision.
Right. And all of this depends heavily on what's called prompt engineering, doesn't it? Basically, writing the perfect set of instructions for ChatGPT. They used ChatGPT 4.0 in this study. It's about controlling the output, stopping it from making stuff up, those hallucinations we hear about. You have to be super specific, down to the commas almost.
You really do. The quality of the prompt is paramount.
Now, when it came to actually measuring how well this all worked, the researchers used a two-pronged approach. Very thorough. First, they tested their method against a manually labeled dataset, 2,000 reviews, labeled by humans calculating standard metrics like precision, recall, F1 scores. You know, the usual suspects in machine learning evaluation.
Okay, the standard checks.
And second, they did a comprehensive manual evaluation using 3 different random sampling methods on the huge 500,000 review dataset. This was crucial to check for reliability and stability, making sure the performance wasn't just a fluke on the smaller test set.
And the results. The performance showdown. I heard they were pretty impressive. They really were. Comparing their proposed ABSA template plus COST method against just asking ChatGPT directly for a general sentiment, the difference was quite striking. Their proposed method hit a weighted total precision of 0.944.
Wow, over 94%. That's outstanding precision.
Yeah.
So when it flagged a specific need, it was right almost all the time.
Exactly. And its weighted total F1 score, which balances precision and recall, basically how comprehensive and accurate it is overall, was 0.912. Compare that to 0.843 for just asking ChatGPT directly.
That's a big jump.
It is. We're talking significant improvements across the board.
Right.
For example, 5.4% higher precision overall and 8.2% higher recall for their method.
Yeah.
Those are meaningful gains.
Definitely. Were there differences between the categories?
Yes, interestingly, the patient experience category consistently performed the best. It seems the model was particularly good at picking up on those aspects. Infrastructure and administration had slightly lower recall, which likely reflects that there were just fewer comments specifically about those aspects in the dataset to begin with. But even there, it was still a substantial improvement over the direct ChatGPT approach. So the method proved robust, even with sparser data in certain areas.
And what about reliability and stability across those different sampling methods you mentioned? Was it consistent?
Extremely consistent. The average accuracy across all 3 different sampling modes stayed consistently above 91%.
Nice.
It was 91.8% for simple random sampling, 91.7% for incremental sampling, and 91.2% for equidistant sampling. It really shows the method is robust and dependable, regardless of exactly how you sample the data.
Okay, so the performance is great. it's reliable. But what about the real world? Is this actually practical? What about cost and time?
That's the other really compelling part. It's surprisingly feasible. The average cost to process 1,000 reviews, approximately USD $1.90.
Seriously, that cheap?
Yeah. And in terms of speed, it took about 55 minutes to process those 1,000 reviews. That works out to roughly 3.5 seconds per individual review.
Okay, so what does this all mean? It means this isn't just some cool academic paper. It's actually practically and financially viable for real healthcare organizations to use right now.
Absolutely. This really transforms how we can get insights. This study allows for discovering truly valuable information from the patient's perspective on a massive scale. And that will significantly contribute to enhancing patient experience, which in turn should lead to better healthcare resource allocation. We're talking tangible improvements driven directly by the patient voice.
I could totally see that. Like, imagine being a hospital administrator. You could regularly collect all the online reviews, run them through this system, and then instantly see, okay, we have a high percentage of negative comments in the infrastructure category this month. That immediately flags a clear pain point, doesn't it?
Exactly. It's like an early warning system. And then you can combine this with other techniques. Maybe run a word frequency analysis on just the negative infrastructure comments or generate a word cloud. That helps you drill down into why people are dissatisfied. Is it the long waiting times, the cleanliness, staff attitudes at registration? This gives administrators a clear roadmap for where to focus improvement efforts.
And if we zoom out even further, think about governments using this. They could assess how effective certain health policies are, or compare resource distribution between different regions, or even between different levels of hospitals.
Seriously.
It's about making policy with much more precision, avoiding waste, and really understanding where to put money and effort for the biggest impact on patients. This kind of big data approach, it's like a collective voice.
It really is. It aids in rational distribution and just fundamentally improving healthcare delivery. The potential impact here is massive.
So this research really sets a new standard then.
I believe so. It's a pioneering step in using LLMs for this kind of detailed aspect-based sentiment analysis specifically on patient reviews, especially where older methods kind of fell short because the data for specific complaints might be sparse. It shows how you can guide these powerful LLMs with smart frameworks like prompt engineering and chain of thought to tackle really complex language tasks in healthcare. It's not just about applying AI, it's about designing AI applications intelligently.
Now, no study is perfect. The researchers themselves were upfront about limitations and where things could go next. What did they highlight as areas for future work?
Yeah, and that's always the sign of good research. One key area is potentially moving beyond just those three broad categories.
Right, getting even more granular.
Exactly. While the current setup is clearly effective, having more detailed subcategories could potentially reveal even deeper insights. Imagine, say, 5 or 10 different aspects just within physician skills.
That makes sense. What about the data source itself? Any potential issues there?
Well, there's always the background concern of data censorship with online platforms.
Yeah.
Even though platforms like hotf.com state they don't censor reviews, you can never be 100% certain that some negative reviews or specific types of complaints aren't being filtered or removed before they even get into the data set.
Yeah.
That could subtly skew the results. It's an inherent challenge.
True. And on the AI side, the technical stuff, what's next there?
Well, the study used chain of thought, which is great, but it didn't incorporate the very latest, most advanced methods like tree of thought or graph of thought.
Okay, what do those do differently?
They allow the AI to explore multiple lines of reasoning simultaneously or build more complex logical structures rather than just a single linear chain. They could potentially boost accuracy even further. There's also always room for hyperparameter optimization, basically, fine-tuning the internal settings of ChatGPT itself to squeeze out even better performance. That's an ongoing research area.
And lastly, that challenge of manual labeling. Labeling 2,000 reviews is a lot of work, but it's still tiny compared to 500,000. What's the dream scenario there? The long-term goal really is for LLMs to get good enough to automatically label data reliably while still ensuring high accuracy. That would be a massive leap forward for dealing with these enormous data sets we have now. It would free up human experts to focus on the interpretation and action rather than the tedious labeling work.
Okay, so wrapping up, we've explored how this really novel combination, these aspect-based sentiment analysis templates plus chain of thought prompting, lets ChatGPT effectively identify and categorize specific patient healthcare needs right from online reviews. And it does it with impressive accuracy and at a practical cost. It feels like a potential game changer for really understanding healthcare from the patient's viewpoint, turning all that messy text into clear, actionable insights.
Definitely a significant step forward.
So this leaves us with a final thought to chew on. If patient feedback, when parsed by advanced AI like this, can so precisely reveal where healthcare needs to improve, what other huge, untapped pools of public sentiment are out there? What other public services or aspects of our daily lives could be revolutionized by listening better, using these kinds of tools? Think beyond healthcare. What feedback could you share that might actually drive positive change, something to mull over?